qualities that I am looking for in my workforce is definitely their education levels, right? How much experience do they have really working in a classroom setting or with a child?
When building a sustainable workforce in the child care field, people automatically jump onto the higher education. They think more training, higher education is going to create, a more qualified provider, teacher, and that will create more quality in child care. Makes sense.
Higher income families, it's very important from a public policy perspective to provide direct subsidies for child care, either from federal perspective or a state perspective, so that more families can find affordable child care facilities to send their children to, and that we can keep our labor force working and people are not having to make the difficult choice between working and looking after their children when they're much younger. So I've gone through sort of a set of challenges that we face here in Northwest Arkansas and a set of opportunities that are available for us to address those challenges.
On the flip side of that, I'm always open to somebody who's new and fresh out of school that I am able to train. Some of my best, longest early child care education workers are the ones that I got right out of the gate, and I was able to grow and give those tools along the way. Obviously, I want to retain my team, and I think retention is key.
However, when a person gets their credentials, they realize that they are working in a field that makes very low income. So they'll move on. We saw it when I was a director at Head Start. They were forcing teachers to become have bachelor's degrees. The minute they would get their bachelor's degree, they would go on to the higher education because there's where they could make more money. They could get their benefits, paid days off, they could get retirement, health insurance, all the things that aren't available in the early childhood fields.
With that, I've got to have competitive benefits, and that's going to be insurance, that's going to be vision, dental, 401k, reduced child care, and then some funding to advance their professional careers, right? So I like to put mine through their CDA, or if they're going for a bachelor degree or even a master's degree, I want to be a piece of that with them. And so that is what I'm looking for.
With the research showing that birth to 5 has such a high impact on later in life, it only makes sense that we're going to have to find a way to invest in compensating early childhood professionals for the job that they do. They need to be compensated and shown that they're valued, respected. They need the benefits that everybody else is able to have with health insurance and paid days off. They need a retirement plan. We just need to show them their value. That's what's going to be important, is compensating them for the hard work they do.
We would like to thank all of those who participated in our endeavor to show the impact of quality care in our community. Get involved, contact our office with the information shown below.